Ciao mondo, hello world, hola mundo, hello mon, konnichiwa, ni hao, namaste. We're here in Rome with Professor Tiago Reis from Latin America, Brazil, Sao Paulo. But as you can see from the dress, also former fellow of IRRIV in Vicenza. And we are at the Consensus Conference on Hemoabsorption Hemodialysis, a new therapy for probably correction of some disorders that are not corrected by classic dialysis treatments. So we have groups that are interested in indications. We have a group interested in monitoring, and your group is specifically focusing on what?
Well, my group is specific focused on the prescription of the therapy and on the delivery of the therapy. So we will cover mainly that for, based on our experiment and agreement that the application of the therapy does not differ from the application and prescription of regular hemodialysis or hemodiafiltration concerning blood flow, concerning anticoagulation, concerning the monitoring of pressures. So we think that that's key for an easy implementation from the nurse perspective and also from the perspective of having the dialysis center not disrupted on its normal regular.
So basically, those who want to begin this type of treatment and technique, they just have to consider that it's just a question of adding a cartridge of sorbents upstream before the filter, and that they continue the therapy, whatever the therapy is, if it is low flux, if it is high flux, if it is HDX, if it is hemodiafiltration, doesn't really matter. They basically add this absorption component, right?
Yes, there is not a complexity on applying it. So we want to show that in our manuscript, we want to transmit this message that is simply to apply and will not disrupt the regular.
Your prescription will also address how frequently to use this treatment, because it might be that this treatment is expensive, so you may not need to do it every session, right?
Yes, we have an analogy to what we do maybe with antimicrobials. We might have an attack phase where we will apply the therapy in a period of like 2 to 3 weeks every session. And then we might de-escalate and downgrade to twice a week, and finally as a maintenance phase once a week or every fortnight.
So that's important, because if you consider the kinetics of the larger molecules, once you are in the maintenance phase, maybe it doesn't make sense to do it every session, because you have to give time to this molecule to transfer from the interstitium to the intravascular space.
Yes, it's the rebound phenomenon, so that we can take profit to remove more molecules when they have a higher concentration after a while.
So what do you expect from this conference, Tiago?
I expect that people, the community of nephrology, will realize that it's already the time for adsorption. So this is not the future anymore, this is the present, and that there is no complexity in applying the therapy every day.
So that's a very interesting message, and we will try to convey this message in the manuscript. We are always trying to improve the quality of life of our dialysis patients, and maybe this is a good chance to get a step forward in correcting some specific symptoms. For example,
restless leg syndrome, or chronic kidney disease associated pruritus, or dialysis recovery time, dialysis fatigue, malnutrition, yeah.
And hopefully, if this will result in less hospitalization and better quality of life, patients can also be restituted to the normal life, to the work capacity, and become again part of the society with no feeling to be sick or disadvantaged, right?
Yes, I totally agree, and I think we are already moving for cold and heartless outcomes such as hospitalization or mortality to patient-reported outcomes and put in the first place the quality of life of our patients.
Very good. So thank you very much, Tiago Reis. We are in Rome at the Consensus Conference on hemoabsorption hemodialysis for chronic dialysis patients. The manuscript will probably describe all the results and the resolutions from the initial questions and the statements of the group. With this, thank you very much for joining Cappuccino and have a wonderful, wonderful day. Excellent.
Excellent.